Hello, and welcome to What Every Man Needs to Know About Strokes. Today, we're tackling a critical health topic that affects many men over 40, and understanding it is crucial for your well-being. Did you know that strokes are a leading cause of death in men over 40? In 2022, 17.5% of cardiovascular disease deaths in the U.S. were due to strokes, highlighting their serious impact. Understanding strokes isn't just about statistics, it's about protecting your health and the well-being of your loved ones. Being informed empowers you to take proactive steps. So, what exactly is a stroke? Imagine your brain as the control center of your body, responsible for every thought, feeling, and action. A stroke occurs when blood flow to a part of your brain is interrupted, either by a clot blocking a vessel or by a vessel rupturing and bleeding. This causes critical damage. When your brain doesn't get oxygen, things go wrong fast, leading to brain cell damage. This deprivation can result in permanent disability or even be life-threatening. Most strokes, about 87%, are ischemic, caused by a clot blocking a blood vessel. This blockage prevents essential blood flow and oxygen from reaching brain tissue. The less common, but often more severe, hemorrhagic strokes happen when a blood vessel ruptures and bleeds into the brain. This internal bleeding creates pressure and damages surrounding brain cells. There are also transient ischemic attacks, or TAs, which are mini strokes. These are critical warning signs that shouldn't be ignored, as they often precede a full-blown stroke and require immediate medical attention. Recognizing the symptoms of a stroke quickly is crucial for effective treatment and better outcomes. We use the simple, fast method to help everyone remember these vital signs. F stands for face drooping. Does one side of the face droop or feel numb? Ask the person to smile and observe if one side is noticeably lower. A is for arm weakness. Is one arm weak or numb? Ask the person to raise both arms. If one arm drifts downward or cannot be lifted, it's a significant sign. S is for speech difficulty. Is their speech slurred, or are they hard to understand? Listen for garbled words or difficulty forming sentences, which are clear indicators. T is for time to call emergency services. If you see any of these signs, even if they go away, call 911 immediately. Every minute counts in stroke treatment, so prompt action is vital. Guys, if your buddy's face looks off during a game or they struggle with their arm or speech, don't wait. Act fast and call for help immediately, as early intervention is key. Other symptoms can include sudden numbness or weakness on one side, confusion, vision problems, dizziness, or a sudden, severe headache. These also warrant immediate medical attention. Now, let's talk about risk factors, especially for men over 40. Many of these are controllable through lifestyle changes and medical management, offering a chance to significantly reduce your risk. High blood pressure is a major culprit. Regular monitoring and management are key to preventing stroke, as uncontrolled hypertension severely damages blood vessels over time. Smoking significantly increases your risk. Quitting is one of the best things you can do for your health, as it dramatically improves cardiovascular function and reduces stroke likelihood. High cholesterol and diabetes also contribute to stroke risk. Managing these conditions through diet, exercise, and medication is vital for protecting your brain and overall cardiovascular health. Obesity and a sedentary lifestyle are other factors. Staying active and maintaining a healthy weight can make a huge difference, significantly lowering your stroke risk and improving overall well-being. Excessive alcohol consumption can also elevate your risk. Moderation is important, as heavy drinking can increase blood pressure and contribute to other stroke-related health issues. As men, we often ignore checkups, but managing these factors can save your life. Regular medical attention and proactive health choices are crucial for stroke prevention. Regular medical checkups are your first line of defense. Don't skip them, as they allow for early detection and management of critical risk factors before they become serious. In conclusion, understanding strokes is paramount for men over 40. Being informed is a critical step towards protecting your health and ensuring a longer, healthier life. We've covered what a stroke is, how to recognize symptoms using FAST, and key risk factors. This knowledge empowers you to act quickly and potentially save a life. Knowledge is your best defense. Stay informed and healthy, as proactive awareness of stroke signs and risk factors can make all the difference in prevention and outcome. Share this video with your friends and family. Early detection and healthy habits are crucial, as spreading this vital information can help protect more lives from stroke. Join us for future episodes where we'll delve deeper into prevention and recovery. We'll explore more strategies to keep you and your loved ones safe and informed. Remember, this information is for educational purposes only and not a substitute for professional medical advice.
In our last episode, we explored in detail what a stroke actually is, including the different types like ischemic and hemorrhagic, and we identified its key risk factors such as high blood pressure, smoking, diabetes, and high cholesterol that particularly affect men over 40. Today, we shift our focus from simply understanding these risks to actively taking control of our health through proactive prevention strategies that can significantly lower your chances of experiencing a stroke. One of the most impactful changes you can make starts with your diet, where eating heart-healthy foods is absolutely crucial for stroke prevention, as it directly helps in managing blood pressure and reducing plaque buildup in your arteries. Start by reducing your intake of sodium to under 2,300 milligrams per day, cutting back on saturated fats found in red meats and fried foods, and avoiding processed foods like canned soups and fast food, all of which can contribute to high blood pressure and elevated cholesterol levels that heighten stroke risk. Instead, embrace leafy greens like spinach and kale, which are rich in vitamins, minerals, and potassium that help regulate blood pressure, and include fatty fish like salmon at least twice a week, packed with beneficial omega-3 fatty acids that reduce inflammation and support heart health. Whole grains, such as oats for breakfast and brown rice for meals, also play a vital role in maintaining a healthy cardiovascular system by providing fiber that lowers cholesterol and stabilizes blood sugar levels, making them essential for long-term stroke prevention. Remember, simple swaps like using fresh herbs such as basil or rosemary and spices like garlic powder instead of salt not only enhance flavors, but can make a big difference in reducing your sodium intake without sacrificing taste in your daily cooking. Beyond diet, regular physical activity is a cornerstone of stroke prevention, as it strengthens your heart, improves circulation, and helps control weight, all of which are critical for men over 40 looking to protect their brain health. You don't need to be an athlete to benefit. Consistency is far more important than intensity, so find activities you enjoy and stick with them to build a sustainable routine that fits your lifestyle. Aim for at least 30 minutes of moderate intensity exercise most days of the week, which adds up to about 2.5 hours total, helping to lower blood pressure and improve overall cardiovascular fitness without overwhelming your schedule. Activities like brisk walking in your neighborhood, cycling on local paths, or swimming at the community pool are excellent choices to keep your heart healthy, offering low-impact ways to get moving and reduce stroke risk effectively. Think of exercise as a vital daily habit, just like brushing your teeth each morning and night, because it's essential for your overall well-being and plays a key role in preventing serious health issues like stroke over time. Regular medical checkups are indispensable for monitoring key health numbers, allowing you to catch potential problems early and make informed adjustments to your lifestyle before they lead to a stroke. It's crucial to understand and manage your blood pressure to keep it below 120/80, cholesterol levels with LDL under 100 milligrams per deciliter, and blood sugar with fasting glucose under 100 milligrams per deciliter, as imbalances in these can directly contribute to artery damage and clot formation. Think of these metrics as a regular health report for your body's engine, providing clear insights into its performance and alerting you to any maintenance needs, much like checking your car's oil to prevent breakdowns. Your doctor can help you interpret these numbers in the context of your personal health history and develop a tailored plan, perhaps including medications or further tests, to keep everything in a healthy range and minimize stroke risk. Beyond diet and exercise, certain lifestyle adjustments can significantly reduce your stroke risk by addressing other common pitfalls that affect men over 40 in their daily lives. Quitting smoking is perhaps the single most important step you can take, as it dramatically lowers your risk within just a few years by improving blood flow and reducing the damage to your arteries caused by nicotine and toxins. Moderating alcohol intake is also vital, aiming for no more than 1 or 2 drinks per day. Excessive drinking can elevate blood pressure, lead to irregular heart rhythms, and increase stroke risk. So choosing water or non-alcoholic options at gatherings is a smart move. Managing stress through techniques like daily meditation for 10 to 15 minutes, pursuing hobbies such as fishing or reading, and ensuring adequate sleep of 7 to 9 hours per night further supports your brain and heart health by lowering cortisol levels and promoting recovery. In summary, preventing stroke involves a holistic approach encompassing a nutrient-rich, healthy diet, regular, consistent exercise, diligent management of key health numbers through checkups, and positive lifestyle choices that eliminate harmful habits. By embracing these pillars of prevention, you empower yourself to live a longer, healthier life full of energy and independence, taking charge of your health in ways that truly matter for your future. Join us next time as we delve deeper into the different types of strokes, including ischemic and hemorrhagic, and explore their specific treatments and recovery options to equip you with even more knowledge.
Welcome back to What Every Man Needs to Know About Stroke. In our previous episodes, we explored understanding risks and prevention. Today, in episode 3, we delve into the different types of strokes and the immediate medical responses crucial for survival and recovery. First, let's discuss ischemic stroke, the most common type, often described as a brain attack. This occurs when a blood vessel supplying the brain is blocked, much like a traffic jam in an artery. This blockage deprives brain cells of vital oxygen and nutrients, leading to their damage or death. Ischemic strokes are frequently caused by blood clots that either form elsewhere and travel to the brain, known as embolic strokes, or develop within the brain's vessels due to plaque, called thrombotic strokes. A key treatment for ischemic stroke is the administration of tissue plasminogen activator, or TPA, a powerful clot-busting medication. TPA is most effective when given within a critical window of 3 to 4.5 hours from symptom onset. In some cases, a mechanical thrombectomy, a procedure to physically remove the clot, may also be performed. Now, let's turn our attention to hemorrhagic stroke, which involves a blood vessel bursting in the brain. Think of it like a leaky pipe causing damage to the surrounding area as blood spills into the brain tissue. Causes often include aneurysms, which are weakened blood vessel walls, or arteriovenous malformations, known as AVNs. Uncontrolled high blood pressure is a significant risk factor for this type of stroke. Treatment for hemorrhagic stroke focuses on controlling the bleeding and reducing pressure on the brain. This may involve medications to manage blood pressure and clotting, or potentially surgical intervention. Surgical options can include craniotomy to remove blood and relieve pressure, or surgical clipping to stop blood flow to an aneurysm. Regardless of the type, the golden rule for stroke is time is brain. This emphasizes the critical need for rapid diagnosis and treatment. For every minute a stroke goes untreated, millions of brain cells die, potentially leading to permanent disability or even death. Recognizing stroke symptoms quickly and calling emergency services immediately is crucial. The FAST acronym helps identify the main stroke symptoms. F stands for face drooping. A is for arm weakness. S is for speech difficulty. And T means time to call 911. Welcome to the final episode of What Every Man Needs to Know About Strokes, Episode 4. In this series, we've delved deeply into understanding the risks associated with strokes, recognizing the critical symptoms early on, exploring effective prevention strategies, and examining the best treatment options available today. In today's episode, we turn our attention to the hopeful and inspiring path of recovery and rehabilitation after a stroke. While a stroke can indeed be a profoundly life-changing event for men over 40 and their families, it certainly doesn't mark the end of one's story. Rather, it serves as the beginning of a meaningful journey toward regaining strength and independence. The road to recovery is truly a collaborative effort that relies on the essential pillars of rehabilitation therapies, which work together to help survivors rebuild their lives. These specialized therapies play a crucial role in helping individuals regain their independence, enhance their daily functioning, and significantly improve their overall quality of life post-stroke. Physical therapy stands out as a vital component in the recovery process, focusing on rebuilding strength, improving balance, and restoring mobility for stroke survivors. It empowers patients to relearn fundamental movements like walking and standing, while also building the endurance needed for everyday activities, often through guided sessions with trained professionals. By incorporating targeted exercises such as leg lifts, arm reaches, and balance drills, physical therapy effectively helps rebuild muscle memory and coordination, allowing patients to navigate their environments with greater confidence and reduced risk of falls. Occupational therapy is dedicated to helping survivors relearn essential daily activities, or ADLs, including tasks like dressing themselves, preparing simple meals, eating independently, and even writing or using utensils. The primary goal of this therapy is to restore a sense of independence in these routine tasks, making daily life more manageable and fulfilling. Occupational therapists assist by adapting everyday tasks and modifying home environments to accommodate a survivor's evolving abilities, such as installing grab bars or using specialized tools, which in turn fosters greater self-sufficiency, boosts confidence, and reduces feelings of dependency on others. Speech-language pathology is essential for addressing challenges in communication abilities and swallowing difficulties that many stroke survivors encounter. This therapy supports individuals in rediscovering their voice through exercises in speaking, and it also ensures safer eating practices to prevent complications like choking or aspiration. From practicing clear articulation of words and sentences to enhancing comprehension of language, speech therapy plays a pivotal role in restoring effective communication skills, which not only aids in social interactions, but also greatly contributes to an improved overall quality of life for survivors and their loved ones. One of the most remarkable aspects of stroke recovery is the brain's incredible capacity to heal itself, a phenomenon scientifically termed neuroplasticity, which allows it to reorganize and form new neural connections even after significant damage. This adaptability means that with consistent effort and therapy, the brain can compensate for lost functions by strengthening alternative pathways. It's important to remember that meaningful progress in recovery remains possible even years after the initial stroke event, as the healing process can continue over time. View recovery not as a quick race, but as a steady marathon, where every small victory, like taking an extra step or speaking a clearer word, deserves to be celebrated as a step toward a brighter future. So, embrace this entire journey with an open heart, openly acknowledge the inevitable challenges along the way, and make it a point to celebrate each and every step forward, regardless of how modest it may seem in the moment. Stroke survivors, particularly men over 40, frequently grapple with emotional and psychological hurdles such as feelings of depression, heightened anxiety, and deep frustration stemming from their changed abilities. Recognizing and validating these emotions is a crucial first step in addressing them effectively and moving toward emotional healing. Building and maintaining a robust support system is absolutely critical for successfully navigating these emotional challenges during recovery. Loved ones like family members, close friends, and participation in dedicated stroke support groups can offer the invaluable encouragement, understanding, and practical help needed to foster resilience and hope. Forming connections with fellow survivors and supporters who truly understand the unique experiences of living through a stroke can profoundly impact your emotional well-being, providing a sense of community, shared wisdom, and reduced isolation that makes the recovery process feel less daunting. Simple acts, like friends joining a survivor for a gentle walk in a serene park setting, offering a steady hand for balance, or sharing uplifting words of encouragement, beautifully illustrate the transformative power of community support in everyday moments. To wrap up this episode, we want to emphasize the powerful message of hope and unyielding resilience that defines the path of stroke recovery for survivors and their families. This journey stands as a true testament to the enduring strength and adaptability of the human spirit in overcoming adversity. As we conclude this series, let's reflect on the 4 essential key takeaways we've gained together. First and foremost, it's vital to know the warning signs of a stroke right away, using the simple and memorable FAST acronym: face drooping, arm weakness, speech difficulty, and time to call emergency services. Second, take proactive steps to control your personal risk factors by adopting healthy lifestyle choices, such as regular exercise, a balanced diet, quitting smoking, and working closely with your doctor for proper medical management of conditions like high blood pressure or diabetes. Third, if you or someone else shows any signs of a stroke, act immediately and decisively. Because every minute counts, time is absolutely critical in receiving prompt treatment that can minimize brain damage and improve outcomes. And finally, always keep in mind that recovery after a stroke is indeed a personal journey, one that includes periods of steady progress, inevitable challenges, and an unwavering sense of hope that guides you toward reclaiming your life. Thank you so much for joining us throughout this important series on stroke awareness and recovery. It's been our privilege to share this knowledge with you. Please continue to stay informed, remain ever vigilant about your health, and hold on to hope in all circumstances.